Did you wake up with inflammation, redness, and excruciating pain in the big toe of one of your feet? Be careful, it's the first symptom of gout. Gout is a type of arthritis caused by the deposition of microscopic uric acid crystals in the joints, causing local inflammation with severe pain. This disease usually occurs between 40 and 60 years of age and is more frequent in men than in women in a ratio of 9:1. In medical terms, the elevation of uric acid in the blood is called hyperuricemia, which in 90% of cases is due to a malfunction of the kidneys, due above all to congenital kidney defects, where these organs can't efficiently remove uric acid from the blood. Other factors that can raise blood uric acid levels by this same mechanism include medicines, for example diuretics and salicylates, frequent intake of alcoholic beverages, high cholesterol and triglycerides, obesity, diabetes mellitus, and high blood pressure. The development of gout goes through 4 stages, which are asymptomatic hyperuricemia, acute gouty arthritis, intercritical period, and Tophaceous gout. In asymptomatic hyperuricemia, uric acid is elevated, but there are no symptoms of gout. That is, there's no gouty arthritis. Arthritis means inflammation of the joints. In general, high levels of uric acid in the blood are usually present for many years before the disease of gout manifests itself, and it's estimated that only a minority of people with hyperuricemia, less than 20%, develop gouty arthritis. The clinical signs and symptoms of gout start from the first picture of joint inflammation, that is, acute gouty arthritis. In 90% of patients, the first attack of gout affects only one of the lower extremities in its distal part, which is usually the big toe of one of the feet. The discomfort usually begins suddenly, and in less than 24 hours, the pain becomes unbearable. The attack usually occurs at night and wakes the patient. The skin of the inflamed region is tense, warm, shiny, and rather purplish in color. The intensity of the pain prevents the patient from wearing shoes and walking. The intercritical period of gout refers to the time between one acute attack and other. After the first attack, a second attack usually occurs, although months or even years may pass before its appearance. Successive attacks can occur in the same joint or in other joints, such as the knee, fingers, wrist, or elbow. Without proper treatment, the interval between gout attacks decreases, and gout attacks occur not only in one but in several joints and tend to last longer. In advanced stages, gout can present with persistent pain and inflammation, without asymptomatic periods in several joints at the same time, which is called gouty arthropathy. Finally, Tophaceous gout is characterized by the accumulation of uric acid crystals called tophi, which consist of masses that form small, painless subcutaneous nodules, usually in the ears, the joints of the hands, or the back of the elbows. The usual time for their appearance is 10 years or more after the initial attack of gout, and they tend to grow in size and number over time, with destruction of joint cartilage and bone erosions. The signs and symptoms of gout allow the clinical diagnosis of this disease to be established and can be confirmed by the demonstration of monosodium urate crystals in the synovial fluid or in a tophi. Hyperuricemia, that is, uric acid levels in the blood above 7 mg over deciliter, is also a useful piece of information for diagnosis. However, approximately 30% of patients with gout have a normal blood urate level at the time of the acute attack. Now pay attention, because the most important thing is coming. The treatment of gout includes 2 schemes, which are aimed at different problems at different times. 1. The treatment of the acute attack, and 2. Control of hyperuricemia. The acute attack of gout refers to the moment when the patient is suffering from the symptoms of pain and inflammation, and therefore it's required to eliminate these terrible discomforts as quickly as possible. For this purpose, treatment includes general measures and natural remedies or medicines. The general measures consist of apply cold water compresses to the affected joint or immerse the feet, if this is the damaged region, in a container of cold water for 15 minutes. Elevate the extremity of the affected joint. Drink 2 to 3 liters of water per day and avoid foods rich in purines, such as red meat, organ meats, and alcoholic beverages, which are explained later. As for natural remedies, one of the following is recommended. 1. Baking soda water. This remedy is very simple to make. It only requires a teaspoon of bicarbonate and a glass of water. The bicarbonate dissolves in the water and that's it. It's recommended to take a glass daily. 2. Ginger and lemon tea. To make this formula, you will need 1 tablespoon grated or powdered ginger, the use of half a lemon, and 300 milliliters of water. Its preparation consists of boiling the water with the ginger for 3 minutes, then turn off the heat. Cover the container and let the mixture rest until it's lukewarm. Strain it, add the lemon juice, and that's it. If desired, it can be sweetened with honey to taste. Drink 1 cup per day. And 3. Horsetail tea. To prepare this recipe, you will need 20 grams of dried horsetail and 500 milliliters of water. Now, for patients who prefer medicines in the treatment of acute gout attacks, the indicated ones are 1. Non-steroidal anti-inflammatory drugs, for example, ibuprofen, indomethacin, naproxen, or diclofenac. 2. Colchicine. Due to the potential for severe toxicity, colchicine should be administered only when NSAID therapy is contraindicated or has failed. And 3. Glucocorticoids. They're recommended in patients in whom NSAIDs are contraindicated. It can be administered, for example, oral prednisone or intramuscular triamcinolone. Obviously, allopathic medicines must be prescribed by a doctor, since self-medication is not recommended. Let's now look at the treatment for the control of hyperuricemia, whose purpose is to reduce the amount of uric acid in the blood to less than 6 milligrams over deciliter and keep it there. This control is carried out when the patient is not in an acute attack of gout and helps prevent gout attacks and its complications. Treatment includes general measures and home remedies or medicines. The general measures consist of drinking 2 to 3 liters of natural water daily, avoiding excessive consumption of foods rich in purines, and exercising. For the latter, low-impact activities such as walking, cycling, and swimming are recommended, which are more comfortable for the joints. For their part, natural home remedies to help reduce uric acid in the blood are 1. Cherry and pineapple juice. The ingredients required to make this juice are 3/4 of a cup of cherry juice, a slice of pineapple, half a tablespoon of turmeric powder, and half a tablespoon of ginger powder. The pineapple is passed through a blender to turn it into a puree, and then it's mixed with the other ingredients. If desired, honey can be added to taste. It's recommended to drink a cup every 3rd day. 2. Diluted apple cider vinegar. The ingredients to this remedy are 10 milliliters of apple cider vinegar and a cup of warm water. Its preparation consists of adding apple cider vinegar to warm water and that's it. If desired, honey can be added to taste. Drink a cup every 24 hours. And 3. Citric fruits. Citrus fruits such as orange, lemon, grapefruit, cherries, strawberries, raspberries, cranberries, apples, grapes, and bananas help lower uric acid levels. It's recommended to eat at least one of these fruits daily. On the other hand, for those who prefer medicines to control hyperuricemia, there's a group of them. For example, allopurinol, febuxostat, benzbromarone, and colchicine. Of these, by far the most widely used is allopurinol, but, as in the cases of the previous drugs, it will be the treating physician who determines the most appropriate medication, the doses, and the duration based on the characteristics of the patient and the intensity of the disease. Now, we've already said that it's recommended to avoid foods rich in purines because they're metabolized in the body and become uric acid. But what are these foods? Here you have them. Due to their effects on gout, foods can be classified into three groups, A, B, and C. Group A foods contain high levels of purines, approximately 150 to 1000 milligrams per 100 grams, so it's recommended to avoid them as much as possible. The main of these are liver, brains, kidney, heart, gizzards and viscera in general, fish roe, sardines, herring, anchovies, mussels, sauces, broths, wine, and beer. Group B foods contain moderate levels of purines, that is, from 50 to 150 milligrams per 100 grams. It's recommended to restrict them to one daily serving. Here are the main ones. Meats except those mentioned in Group A, fish except those mentioned in Group A, chicken, peas, cauliflower, asparagus, whole grains, zest, broad beans, lentils, spinach, and mushrooms. Finally, Group C foods contain negligible levels of purines, so they don't affect gout and they can be eaten regularly. Here are the main of them: milk, cheese, egg, fruits, sugar and candy, vegetables except those mentioned in the previous group, spices and seasonings including salt and vinegar, refined cereals and cereal products, butter and fats but in moderation, and clear vegetable soups. Well, with this information, you're now in a position to prepare your food to lead a healthy life, taking maximum care of your uric acid levels. Proper treatment of acute gout attacks allows people to lead normal lives. However, when there's inadequate control, complications can occur, such as severe degenerative arthritis, formation of intra-articular tophi, secondary infections, and formation of kidney stones, which over time can lead to kidney failure. Well, there's no need to allow gout to reach these levels of complication. You already have the elements to avoid it. See you in the next video.